Hi and welcome to tonight's live, where I'm talking about one of my very favourite topics, and that's natural things that you can do to improve egg quality and boost your fertility and improve your chances of conceiving and carrying your healthy baby. Now, joining me tonight is the lovely Dr. Lynn Burmeister. Now, if you don't know of Lynn, Lynn has worked in obstetrics and gynecology for more than 20 years. She has the highest qualifications as fertility specialist can obtain, and that's a CREI, which is a 3-year qualification on top of her fertility, gynecology and obstetrics qualifications. And she received that renowned qualification at the world-renowned Cornell University, working with fertility leader Professor Zev Rosenwachs. Now, since then, Lynn has opened her beautiful clinic, Number One Fertility. If you haven't been there, it's an amazing place, and that was in 2018. And she now has clinics in East Melbourne, in, here she is now, the Beauty, and Geelong and Epworth in Richmond as well. So I'm looking forward to having Lynn join us. Hi, Lynn.
Hi Tasha, how are you?
Good, lovely to see you.
Thanks for inviting me.
I was just telling everyone how amazing you are, your amazing qualifications, your amazing clinic. So I was just touching on the clinic, and I'll get you to take over from there because I know you have a lot going on in your clinic, not only in fertility, but women's health all round. So tell us a bit about what you've been doing.
Yeah, so we're trying to sort of create a one-stop shop for women. And so as you know, I started Number One Fertility. I started off in Geelong because of my year of restraint from Monash. And then we opened up in East Melbourne, and we opened an egg-free centre. We opened Number One Collins Street, and we've opened up our, purpose-built IVF lab at 120 Jollymont Road in East Melbourne, which we call Emerald City. And down below, we've got a floor that we've started Number One Women's Health, and that's going to cover off all aspects of women's health. So from your thin preps, your breast checks, your skin care, we'll do it all under one roof, and shared care, obstetricians care. So we'll have everything. It'll be a one-stop shop for women.
I love your holistic approach to everything, really. And that's why our conversation today, I know we share a lot of patients looking at that holistic approach, getting their egg quality, working on their sperm health. And I guess that's what we're here tonight to talk about, to help people with improving their egg quality through those 90 days, as we always talk about. That's how long it takes to develop that precious egg, and we've both seen remarkable changes if we can work through those 90 days. So if you have questions, I'll try to keep up with them now, and I know we do get lots, so pop them in the chat there, and we'll be sure to get to them. Now, before we came on live, I do have a number of questions that came through that people couldn't join us. And probably the number one thing that I'll start off with is FSH. High FSH, what does that mean, and what can we do to lower that and, I guess, achieve a successful egg collection?
Well, I'll tell you a very exciting story about one of our patients who presented to me about a year ago with an FSH of 118. And so if you've got an FSH above 10 on day 2 or day 3, that is elevated. That's considered elevated. And you have to check your FSH on a particular day of your cycle. But this lady had lost her period. She was only 28. And if she's watching, she'll know who she is. And she came in for a second opinion as she'd been told she's menopausal, there's no hope. And I said, well, there's got to be some eggs there. So what we did with her is we lowered her FSH down with very low dose estrogen treatment to the point where you just supplement the body with a little bit of estrogen, not high enough to stop ovulation though. And we tracked her. We tried a few IVF cycles. They didn't work because adding in FSH often doesn't work because your FSH is high anyway. So adding in FSH. So we started tracking her just naturally. And just before Christmas, she developed a follicle. And we triggered it with, so when we trigger an egg, we use pregnancy hormone to trigger the egg. We triggered it. She had intercourse naturally. We didn't even do an IUI or insemination. And she's now pregnant. So she must be about 8 weeks pregnant. Seen the heartbeat. Everything's going really, really well for her. So if you do have an FSH, an elevated FSH, you need to speak to your doctor about trying treatments, and also people like you, Tasha, trying treatments to bring that level down so that you can commence treatment.
Yeah, absolutely. Oh, that's an amazing story. I love hearing stories like that. And we have seen declines in FSH, because the FSH just means the body's working really hard to produce that egg. So if we can balance the hormones, if we can get that great egg coming through diet and lifestyle, the FSH will come down, and we're going to get a successful cycle. I know we had another shared patient, I think with an AMH of 2, who had multiple failed cycles elsewhere, and I worked with her over the 90 days, and she's now got transfer coming up, but AA grade embryo, which has never happened. So yeah, if she's listening too, I know she was going to join us. That was an amazing result. So yeah, lots you can do. And I've actually got my Your Fertile Pantry program starting on Thursday. There's still a few spots available. So if you do want to work on those 90 days and you want lots of tips and tools around improving your egg quality through diet and lifestyle, and get lots of menu plans and recipes to help make that super simple, follow the link in my bio to do that. Now, I've just got a question come through here. I got my failed IVF in. My weight was 74 kilos, height 152. And now I came to 72 kilos. So how much should I reduce, and when is the right time so I can conceive? I guess question is, what's the ideal weight by the sound of that? How much weight do we need to lose to improve fertility?
Well, they've shown that even just losing 5% of your body weight can improve your fertility. We know that being overweight impacts ovulation. So some people stop ovulating, or they may ovulate irregularly. And also weight affects your quality of your eggs as well. So if you've got a lot of fat cells, they actually are toxic to the eggs, so and reduce the egg quality. And I think some of our patients do have a very poor diet. They eat a lot of carbohydrates, and I really do believe that weight loss can help egg quality. And then it becomes a balance between age and weight loss. But I think some patients who are struggling to conceive are overweight, and they really do need to look at reducing some of those kilos so that they can get pregnant naturally even, or pregnant easier with our fertility treatments.
It can make a big difference, and I'm often having that conversation with patients about age and how long we wait to, I guess, work on their diet and lose that weight. But it does make a big difference, not only just for the weight, but your blood sugar regulation, which obviously we don't want sugar around the follicles. We want it to, your blood sugar nice and stable going into a pregnancy and for ovulation as well. So it makes a huge difference across the board. So congratulations on your weight loss, and even a small amount of weight loss will be significant benefits. So, any thoughts on the carnivore diet when preparing for IVF? Look, it really depends on the person, but I generally know I don't like a strong paleo diet. In general, I have had patients come to me on those strong paleo diets, and it can actually stop ovulation. It can negatively impact egg quality. I prefer a more rounded approach. So definitely be looking at, you're missing out on a lot of colors. I'm a big on colors. You want your reds, you want your blues, you want your oranges and yellows, and you're missing out on a lot of those when you are looking at more of a carnivore type diet. They're very high protein, and protein's critical to egg quality, you know, to produce that DNA to help our eggs develop, but we don't want to be overdoing that protein. So I prefer a more rounded approach with good quality carbohydrates, because that will help with ovulation. Good quality fats, which has been shown to be essential fatty acids, have been shown to improve egg quality and prolong fertility life, and good quality protein. So depends on the person. I'm not a big fan of the carnivore diet in general.
No, they actually have shown that the Mediterranean diet can improve your fertility. So I would stick to exactly what you said, Tasha. And the Mediterranean diet is basically a very healthy diet. So it's lots of greens, lots of reds, lots of yellows, and it's really fish and chicken rather than the red meat.
The Italians knew how to do it. The lycopene that's in, you know, those lovely tomato sauces and soups and those sorts of things. And lycopene is one of the few nutrients. Most nutrients are fairly unstable and lost during heating, but lycopene's improved and actually accelerated during the cooking process. Those tomato pastes and sauces are exactly what the doctor ordered. So what is the main cause of abnormalities in embryo testing and anything that can help it?
Yeah, so when we test an embryo, we take cells off what we call the trophectoderm, which is the outside of the embryo, and that's going to become the placenta and membranes. So we're not taking it off the embryo itself. And we're testing the embryo. If you've got a genetic problem like the breast cancer gene, which is the BRCA gene, we can test your embryo for that. But normally we're testing the embryo for chromosome problems, and that might be Down syndrome, trisomy 18, 16, Turner syndrome. So we can pick up all those chromosome problems as well. Some people have little breaks in their chromosomes called translocations, which cause recurrent miscarriages. So we can actually detect those abnormalities in the embryo as well. So it's not 100% accurate, but it's in the high 90s. It does help women, particularly if they're over 35. I normally recommend they consider it. Because the egg quality declines after 35 quite dramatically, and there's more chromosomal problems after the age of 35 in the eggs.
Yeah, and there is what you can do for those chromosomal abnormalities. I mean, it takes a lot of energy for the body to organize chromosomes in the right order, and during that 90 days that we're talking about is when those chromosomes are being organized into their right places. So if we can optimize the environment in which that egg is developing, it's going to give you the best chance of producing that healthy, viable egg. And the testing is just fantastic the way we are able to do that now. Now, caffeine, we always get this one. Look, it's not good for you. Basically, I always say as close to zero as possible. Most of the research shows that under one cup or less a day, but I like to stick to zero. If you're a decaf drinker, Swiss water decaf, some of them are chemically filtered. I don't like to use those, but a Swiss water decaf is going to be a fine option for that. 3 failed embryo transfers, got pregnant naturally, had a miscarriage at 8 weeks. I'm so sorry to hear. What's next? I mean, I hope this discussion is really helpful for you, and reaching out and getting some support around the testing. And I know you do great testing with your patients, and I love seeing all those bloods, because that's the best insight we have into what's going on, is to get the adequate testing, and it's not always done.
And I think that patient or the person tuning in that's had the 3 failed transfers and the miscarriage, I would suggest that she sees her doctor for a recurrent miscarriage screen and an autoimmune screen to make sure that she doesn't have, like, blood clotting abnormalities, the MTHFR gene. So just to make sure that, or antiphospholipid syndrome, things that are related to miscarriages. So she does need to go pop off and see her doctor about that, and also make sure some doctors haven't even checked their patient's chromosomes, so make sure she's had a normal chromosome, and same with her partner.
Yeah, so getting the right testing, getting the workup, so we can sort of understand what the issue is. So I'm in my 90 days now. Excellent. Next cycle's mid-March. My first few weeks was Christmas and New Year period. How damaging was that? Look, a lot of people slipped up over the Christmas, New Year period. I like to say 80-20 as a general rule of thumb. If we can get 80% good most of the time. And look, it depends what you are having. So, have a listen to this discussion, and there's lots we can do from here on in. And look, even if you are, 90 days is your optimal, but if even you can get a couple of months beforehand, that it's still going to make a positive impact. So even if you are starting a little bit late. So any tips for embryo transfer success?
Okay, well, after your embryo transfer, you should stand on your head for 2 weeks. No. No.
If that was going to work, I'm sure everyone would.
Yes, exactly. No, but it doesn't fall out. So a lot of patients, when we look at a uterus in a picture book, it looks like an empty hole. The uterus is not an empty hole. The uterus has got very fluffy lining called endometrium, and the endometrium is very sticky. So imagine a peanut butter sandwich put together, and then you put little hundreds and thousands in the middle of the peanut butter sandwich, that little hundreds and thousands is not going to fall out. So same with your embryo. We put it into a sticky lining. We use some embryo glue as well. The embryo sticks to the lining. Then for the next 24 hours, your embryo and your uterus will work out whether they're going to be receptive to each other. And then by about 3 or 4 more days, the embryo will be fully implanted. So even if you get up after your transfer and go to the bathroom or go for a walk, it's not going to fall out. It's really got to do with the receptivity of your lining and the quality of your embryo. So that's what's going to make you pregnant. And yes, we can try acupuncture and do other things as well to support that, 2-week wait. But I think also reducing your stress. And so we've started a fertility yoga class also for that 2-week wait, which if people are interested in joining, they should contact the rooms and book in a class. Because I think Amanda's amazing, and she's running the class, and it will really reduce your stress in that 2-week wait, and offer support as well to meet other people in the same situation as you.
Yes, definitely reach out to that. Amanda is amazing. Angia Acupuncture and Yoga, you can probably find her on Insta as well. So that's amazing service there. In regards to uterine lining, I did a great podcast with Dr. Gemma Evans, and she's looking at diet in relation to uterine receptivity. So she talks a lot about what foods to eat and ones to not eat and ones to avoid. So I go through all of this in my Your Fertile Pantry program as well, and give you checklists and everything for those transfers. But the main things is you want to be avoiding barbecued foods from her research, so that really browning of foods and grilling, and you want to be avoiding aged foods as much as possible. So even foods that are normally healthy, say vinegars and kimchis and things like that, anything that's been aged on purpose, and lots of nice fresh fruit and veg. But jump over to my website and the podcast, and Dr. Gemma Evans, she's got some great research into diet and uterine receptivity. They're coming through thick and fast, so we'll get to as many of these as we can. Treatments to help obtain and keep a pregnancy when you suffer from adenomyosis, Lynn.
Yeah, so adenomyosis is basically in the same family as endometriosis. So it's where the endometriosis has eaten into the wall of the uterus, so into the what we call the myometrium, which is the muscle of the uterus. And it makes the uterus enlarge, it makes the uterus soft, and it makes the uterus quite angry, actually. So you've got an angry uterus when you've got adenomyosis. And you often get very painful periods. You might get pain with intercourse. And so when your uterus is angry, it's not the best environment for a little embryo in. And adenomyosis, like endometriosis, is really an autoimmune problem. It's a condition where the endometrium is in a place where it's not meant to be. And so your body hasn't worked out how to fight it off properly. But when it's there, your body's really trying to fight it off. And so it creates a lot of natural killer cells and a lot of white cells that probably don't help with implantation. And we do know patients with endometriosis and adenomyosis do have a lower implantation rate. So if you have repeated failed implantation and you do have adenomyosis, there is a treatment that you can use. And we basically have to put you into a temporary menopause for 3 months. But it has been shown to be effective in studies. So basically we have to either use a Cineral spray that some people have used during their IVF cycle, or a Zoladex implant. And we shut off all your hormones for 3 months. That shrinks the adenomyosis, makes the uterus less angry, and then we can prepare for a transfer.
Excellent. I think that's hopefully that's really helpful there too. And obviously through diet and lifestyle, you're going to be looking again the immune system, NK cells, the microbiome is a great place to start. So even looking at digestive issues, getting the right probiotic, helping to calm down that reactivity and inflammation as much as possible through anti-inflammatory diet. Reducing histamine containing foods can be also helpful, particularly if you're in the endometriosis side, reducing that pain and inflammation and that reactivity of the body. Oh, I see Amanda there. Hey, Amanda, hope you went well with your yoga. Let's see here. Can you talk more about Oh, your Fertile Pantry program. Oh, sure I can. Put a link in my bio. And until my first cycle, I need to eat better, but I'm very fussy with foods. It's all good. I've got so many different foods and varieties in there, and I really go through what you can eat, and I help you create your Fertile Pantry, not just giving you one, give you some done for you menu plans as well, but you're able to create your own with foods that you love and you enjoy. So don't worry, it's not that hard, and I won't make you eat foods that you hate. So 19 progesterone an issue at 7 days post ovulation. If so, what could I do to help boost progesterone?
That is a bit on the low side. So we like the progesterone to be around 30 and above, really, for implantation, particularly on our IVF patients. So that is a little bit low. So you can try a couple of things. You could see if you can see a fertility doctor to take a trigger injection, which we talked about before. So trigger injection of HCG, that will boost your progesterone, or you could try some progesterone pessaries that will boost your progesterone.
Yeah, and there are some natural things that you can do using herbs and diet as well, but don't use them during any stim cycle. We want to support through nutrients if you are using those. So lots of options to do to help support your progesterone. So do you offer the yoga on Zoom? She's in Sydney.
Oh, yes. Well, if you go onto my Instagram from yesterday, we posted our first fertility yoga class. So yeah, have a look at that, and we'll be live again tomorrow at 6:30. So Amanda will be doing another class tomorrow. Spaces are limited for the Melbourne people because of all the COVID restrictions. So we're going to only get 10 safely into our space at the moment. And so if you do want to join tomorrow night, please call us in the morning.
So make sure you go and do that and get onto the fertility yoga, which is great for reducing stress, which is such a support for fertility and in general. So is there anything I should not eat during the 2-week wait? I mean, I guess all the pregnancy foods, really. Is there anything you specifically say, Lynn?
Oh, well, I know a lot of patients, and I don't know where it comes from, but they go and eat French fries on the way home from McDonald's.
I've been asked about that one too. I have a few wives' tales. I get Macca's fries, and I have to say, I can't see from a nutritional perspective they're helpful, but I do love the study that showed that medical clowns, women who were entertained by medical clowns post-transfer, had better pregnancy outcomes. So perhaps the McDonald's fries is just recreating that childishness, that, freedom, those positive neurotransmitters that may have a similar effect. From a nutritional perspective, no. I look at a funny movie or a romantic comedy over your McDonald's fries. There's pineapple is high in bromelain, whether that's going to have any impact, but the bromelain in there is healthy for fertility and uterine lining. I think they're probably the biggest ones I get asked about. A new one comes up every second day, to be honest. So in-person consultation or only group in my Your Fertile Pantry program, if that is a group consultation, but I do offer a 15-minute chat to everyone so I can really get to help you if you have any specific issues. Private Facebook group as well. So lots of personal support, but we do live sessions each week. Every Thursday, they're recorded, they're popped in a portal for you so you can watch them and rewatch them as often as you need if you can't join us live. And then we have Q&As in the Facebook group. So lots of personal support amongst there as well. So super. Can IVF still be successful if you don't have moderate endometriosis removed?
Well, yes. So they've actually done studies on removing endometriosis and not removing it, because endometriosis can get into the bowel and into the bladder. So it actually can be very difficult to remove it completely. And surprising enough, the studies didn't reveal that there was much benefit in removing it. And the IVF outcome. So if you've got endometriosis, treating it medically is probably a safer thing to do, unless you have really bad symptoms and you need to have it removed because of a symptom. If you can't get out of bed when you get your period and things like that, then I think you need to see a doctor who's specialized in removing endometriosis. but you don't need to have it removed for IVF.
Yeah, and looking at all the things we spoke about before with your autoimmune, your reactivity, you know, toning down all those things that can affect implantation. So what's the success rate of a day 7 blastocyst embryo versus a day 5? Have you had any healthy births from day 7 embryos, Lynn?
Well, we usually don't freeze our embryos at day 7, so we either freeze our embryos at day 5 or day 6. If your embryo is going out to day 7, that means it's a bit slower. So that embryo probably doesn't have as good a pregnancy rate as a day 5 embryo.
Yeah, good answer there. So I recently found out I have the MTHFR gene. I've been put on folinic acid tablets since I found out 3 weeks ago and have had a transfer planned this month. Is that enough time between to do a transfer? The MTHFR is something we get asked about a lot. It depends which gene you have. There are different polymorphisms. So there are the 677 and there's the 1298, and you can be hetero or homozygous for those, or you can be heterozygous for both. So that depends on what impact it's having. So look at your homocysteine levels. It's the best marker we have of how well your MTHFR gene is functioning. But in relation to the time frame, folate is one of those nutrients that you can boost quickly. So 3 weeks is absolutely fine. If it's sort of vitamin D or some of those fat soluble nutrients, they can take up to 3 months. Even coenzyme Q10, you want to be on that for some time before it's really through your bloodstream, because they do take some time to get into your bloodstream and to be in those fat stores. But folate, water soluble, so 3 weeks is totally fine. I would check your homocysteine just to make sure that's in an ideal range, about a 6 to 8. And yeah, you're getting a good absorption of folate quite quickly. So all your folate rich foods as well. So I go through my food list, so both food lists as well. So do you recommend cutting out sugar altogether? My thing with sugar, that would be great if we can cut out sugar altogether, but I don't want it to be a stress on the body. It's or you're on yourself, or on, you know, you all got jobs, we're busy, it's not just the only thing you're doing. So when I look at sugar, you just want to be lessening the load of the sugar on your bloodstream. So having pure sugar, we're having lollies and that straight sugar, that spikes your blood sugar. So what you want to be doing, if you are having some sugars, look at your fruit sugars and combine it with some fat or protein. They're your friend. That's why a fruit juice is not going to be as beneficial as a smoothie that's, say, got some LSA mix in there, or some chia seeds or something like that that's got those fats, because that will lower the release of that sugar into your bloodstream. And that's the problem with sugar. It's the up and down spikes that are the issue. So it's not that you have to cut it out completely. You just want to get the right types of sugar, and you want to get it mixed with some fat, fiber, or protein to help slow that release into your bloodstream. So, sorry, it's ticking along there. Would you recommend acupuncture before and after an embryo transfer?
There is some evidence that can help your embryo implant. So we actually have on-site acupuncturists now that do pre and post embryo transfer. So if you'd like to book in with that, for that on the day of your transfer, you can do that at our clinic now.
Yeah, I love acupuncture as well. I find it makes everything I do with patients work better. As I'm a vegetarian, what's the best diet I can do to prepare for IVF? I talk a lot about this in my program as well. You can absolutely have a great diet on a vegetarian diet. You just need to make sure you're not having the potato chip vegetarian diet, which I sometimes see. So what we want to be doing is looking at all your vegetarian proteins, which I give you a big list of the vegetarian sources. So your legumes, your chickpeas, you want to be combining your protein so you're getting the good complete amino acids as well. So you just need to, I guess, be a bit sure that you are getting sufficient protein, because you do want around about a gram of protein per kilo body weight. So looking at your protein sources, making sure we're getting a good rounded diet, but absolutely you can do a good vegetarian diet. Your thoughts on exercise, Lynn? Should I stop doing high intensity classes?
No, I think it's actually good to exercise, clears the mind. So I think after your embryo transfer, maybe tone it down a notch. But if you're used to doing it, it can't hurt you at all. And I think it's good for your mind and your body and your soul keeps your mind, it certainly reduces stress, keeps you healthy. So I'm a big believer in exercise during the cycle. I can't see why you need to stop it if you've already started. I don't think that, joining a gym and, running on a treadmill for an hour when you haven't done it before is a great thing to start when you're trying to get pregnant. You need to work into those things. But I think a great exercise for fertility patients is Pilates, really. I think that's a really great way to keep your body toned without doing the high impact exercise.
Yeah, I love exercise as well, and I agree. If you're doing it before, then you're pretty much right to continue. It's great for blood circulation. It's great for weight loss. I love around that if you're looking at transfers and linings. I think Zumba, hula hoop as well, Pilates, things that focus are on that core and really get that blood flowing around that reproductive system where we want to see it going. Exactly. Should I use Botox during IVF? I guess.
Well, it's not considered safe to use when you're pregnant, and it does stay in your system for a while. So ideally not. Yeah, we just don't know, we don't know if it can be harmful. It's most likely not harmful, but it's not approved in pregnancy.
Yeah. So what are some causes of why ICSI doesn't work, and what would be the next step after that?
Depends why Holly is using ICSI. Is it just because the doctor suggested it, or is there some real male factor there? I would prefer my patients not to use ICSI. It's quite invasive on the egg. So ICSI is where the sperm gets injected into the egg, and they have to use a little glass propel to inject the sperm into the egg. So sometimes the eggs can fragment if they're soft eggs. Sometimes the cytoplasm might leak out of the egg. So we've got to be very careful when we do ICSI, and also who we suggest it for. So usually just men with male factor infertility, if they've got abnormal shapes, or the sperm is swimming really slow, or if the sperm is very, very low in concentration. But if the sperm's normal, there's no need to do ICSI. If your ICSI's failed, that sounds to me that perhaps the eggs didn't fertilize when the ICSI was done. They can do a thing called activation of the egg, and that may help it fertilize next time. So you should ask your doctor about that, and also ask your doctor to even ask the scientists. We do give science consults at Number One Fertility, where you get to speak to the scientists in a consultation about your egg, sperm, and embryo, and what we can do in the lab to actually make your next IVF cycle more successful.
I love those conversations that you offer, and have to say it's so reassuring when patients come to me and they've spoken to the embryologist and they understand what's happened. It helps them move forward to the next step as well, which is great, and also helps me understand what we can do. I know we've got a mutual patient at the moment just pregnant, and their sperm health, it was really, really low, unfortunately, but done a lot of work with him, and we've just got a couple of weeks in, but positive pregnancy there as well. So lots you can do to work on sperm health if it is a sperm health issue. There's lots of key nutrients, and the good news is with sperm, new batch of sperm every 90 days, there's usually a reasonably quick turnover. It can make a big impact in quite a short amount of time. So I've just got skimming on here. Can I reduce my homocysteine levels, and does it affect egg quality? Yes and yes, really. The best things to reduce homocysteine, you can reduce them quite quickly. I've had patients coming into me. I actually had a patient who came into me almost ready to go into a transfer, and started to get a workup, and her homocysteine was 25. So we implemented some right folic acid for her, some B6, B2, your vitamin B12, your B9, which is your folate as well, in the right forms. But hers came down within a couple of weeks down to an 8, which is far more ideal. So yeah, ideally between a 6 and an 8, you can reduce it quite quickly by getting the right supplementation or in dietary sources as well. And yes, you would want to get that under control for egg quality and for the health of the pregnancy as well. So I'm 41 and single, and was recommended ICSI is the preferred way.
Oh, Not if the sperm's normal, I wouldn't recommend it. So particularly if your eggs are 41, your eggs become more fragile, and they're often softer, and they can break. They can break as well when they're doing the ICSI, so they can actually become fragmented. So I would actually say no to ICSI for a 41-year-old. You could do half-half, so half natural, half ICSI, and just see if your natural ones fertilize better. But often it's better just to do natural, particularly as your eggs are getting older.
Yeah, it's a lot of questions around ICSI, and I love your approach to that as well. So with male MTHFR and male infertility, are there diets that help? I mean, everything that's going to be worked, there's not really difference with MTHFR and what we do diet-wise for the male and female. It's all about your folates, your B12s, getting your right B vitamins in there. Stress will have an impact as well. I should mention that. And I do find some men with really high pressure jobs and, poor diets will have that high homocysteine. So magnesium is often great, plus all those Bs that we mentioned, because they need folate as well. Folate's great for sperm health. So yes, all of the things we discussed there as well. How many cycles do most women do, Lynn? Probably a hard to pinpoint question, but...
Well, it's probably age related, and so you probably expect someone between 30 and 35 to be pregnant by their third embryo transfer. Between 35 and 40, it's probably more like 5 embryo transfers, and in your 40s, it could be up to 8 embryo transfers, even 10. But in your 40s, you should really be looking at doing chromosome testing of your embryos and just putting normal ones back. Because so many of your embryos in your 40s will be abnormal. So rather than wasting time putting embryos in that are potentially abnormal, that could miscarry, you're better off having your embryos tested and then putting a tested embryo in. And when you have a tested embryo, chance of conception with a tested embryo is about 50%.
Yeah, that's reassuring. So does fresh or frozen transfer have a higher success rate?
Yeah, so frozen embryos actually have a higher success rate than fresh, although most people are so eager to get that fresh embryo in. But we do know that frozen embryos actually are more successful.
I do love working with frozen embryo transfers too, because we can solely focus on egg quality, and then we can solely focus on that uterine receptivity. So are there any diets or foods that increase egg production? Omega-3 fats, studies have shown that they can increase the follicle count, improve egg reserve, which is really helpful. There are nutrients. Arginine, I caution, just because there is some evidence that you get better numbers, but they're not better quality. So just small doses of that, or avoid that. There is some literature around that, but I'd be focusing on your proteins. So again, you want to be able to make that good quality DNA. You want to get that good quality essential fatty acids, where I use omega-3 supplements as well, or algal oil, or they're vegetarian sources, but getting that DHA is really great for egg reserve and egg production, and getting your hormones balanced, all those things that help with follicle maturation. So 28, 2 miscarriages, which tested as normal chromosomes. How much does stress affect recurrent miscarriage?
It's a hard one to quantify stress, isn't it? Because some people might feel very stressed and some people might not show it. Certainly if I was 28 and had 2 miscarriages, if you were my patient, I would look at doing that recurrent miscarriage screen, your MTHFR, autoimmune screen, get all those checked out. Also get someone to do a very detailed ultrasound of your uterus to make sure you don't have a septum or a love heart-shaped uterus. Fibroids or polyps, they could all affect implantation and miscarriage as well.
Yeah, so as we said before, get a thorough screen. It's really hard to pinpoint what is your issue without getting all the testing done and getting the blood tests and having a look at what's happening for you, because don't make yourself feel bad that it can be stress. So there's lots of things involved. What is a mosaic embryo?
Okay, so a mosaic embryo is where some of the cells have tested normal and some have tested abnormal. So it's got different cells in it, basically. And depending on the type of mosaic embryo, you may be able to put the embryo in. You need to speak to the genetic clinician in your clinic. Some of the mosaic embryos we can transfer without risk, and some of them are too risky to transfer, and we don't recommend that they are transferred due to the increased risk of miscarriage or getting to 12 weeks and finding out it's got some sort of syndrome. So speak to your doctor about whether your mosaic embryo is safe to transfer. Some will be, some won't be.
Yeah. So do you know if antibiotics, penicillin, affects egg quality and follicle stimulation medications?
No, because often we're using antibiotics during the cycle, particularly if someone's done that ERA, Emma and Alice test where we're looking at the microbiome in the uterine lining, and if they do have abnormal bacteria in the lining, we often put patients on antibiotics during their cycle to balance out that microbiome.
Yeah. So antibiotics can actually be great if you've got that bad bacteria taking over, getting that good bacteria as well. So getting the probiotics and the antibiotics right, if it is right for you. So are there any tips to get normal embryos for women in their late 30s, early 40s?
Well, again, that comes down to looking after your health, and that's really all you can do when you are in your later 30s and early 40s. Just looking after your health, having a really healthy diet, exercise, and also look at your guy as well. Remember, 50% of the embryo is about him. And I was shocked yesterday when I was consulting. The guy was still smoking a packet a day, and their embryos were terrible. They'd come from another clinic, and no one had actually given him a lecture about stopping smoking. So no, he was surprised. He was like shocked, and which I thought that was quite amazing that he was shocked that he thought smoking was okay. But still, there's a lot of education even for the guys out there that needs to happen, because 50% is about the egg and 50% is about the sperm.
It makes a big difference. And I always say to my husbands, not my husbands, but our patients' husbands, that it's really important for preconception health. I really want, no pressure, but Olympic athletes, if we've got older eggs, we want perfect sperm as much as possible so that an egg doesn't have to do any extra work than it needs to be able to create that pregnancy. So you really want to be looking at your colors, like I said, antioxidants, key nutrients. I know you recommend ubiquinol and CoQ10 to your patients, Lynn. That is a great supplement as well. It's actually found in follicular fluid, and we produce a lot of coenzyme Q10 when we're younger, but we produce, unfortunately, less and less as we get older. And